So Tordys von Feder, it's a great pleasure to meet you.
Yes, to pleasure for me to meet you as well, Adam Smith.
And where are you now? Where are we speaking to you?
You're speaking to me in Würzburg. It's near Frankfurt. That's the point where I now living. I'm a Hamburg girl, but for my profession, it's Würzburg is very good because you are in the middle of Germany, and I have clients in whole Germany, so it's good to come to all of them.
And what is your business?
Now I'm self-employed, but I was over 20 years in the management, at least at a public-private partnership, from the second one from the German army.
Right.
And they was responsible full service for military clothes and military solutions. So that is a little of where I'm fine with the interview, because I know it is from the EU Parliament, and I know both sides. I know the economy and I know governments.
Ah, fine. Fascinating job. Fascinating. And presumably for the last 2 years or so, you've been doing most of your job from this very room, looking into the camera.
Yes, that's right. I think most of all do that at the moment.
Yes. Is this your normal Zoom setup? Is this your Zoom room, or do you move around the house for your interviews?
No, it is our home office.
It's a very nice setting. So we're here to discover your story, your personal journey through disease, diagnosis and treatment.
Yeah.
Tell me about your first encounter with your condition.
Yes, I go every 2 years to the doctor to make a checkup. And 4 years ago, I make a checkup as well. Yes, now I must look after the word. Sorry, that is wie heißt das? Sorry.
Colonoscopy?
Colonoscopy. Thanks a lot for help. It's not my word. A routine, and I have had a very good doctor who find a small tumor, and I had the luck that he gave me the address from a pioneer of nuclear medicine, and there was had an operation.
Right. So it must have been an awful moment when you heard the news that this had been discovered. How did you react?
Yes, it was horrible, and for me it was one moment or one day. I tried to look what it is, because I doesn't know the word nuclear neuroendocrine tumor, and what does that mean? But I'm a person, you can say a little stand up, then say, okay, that's it. Then you have to find the best doctors. And when I worked to the diagnostic, to the clinic diagnostic, I was a little more relaxed. I say, okay, that's it. You have it, and you must see what happened and what will be the results, and then you have to live with them.
Mm.
I'm not a person who reads all what can happen on something like that. I say, okay, the situation is there, and you must make the best of it.
This all sounds very sensible and pragmatic and strong.
Yes, it's a little my way.
I begin to see why you might be very good at dealing with the military.
For me, it's the same. I don't really read the recepts or what can happen if you get injection or something like that. Mm. For me, it's okay. I know I have good doctors behind me and a good medicine, but my feeling is to say, if I feel not good or have something, I can ask, but I don't want to know before what all can happen.
Mm-hmm. Very wise. So you mentioned that this was your first encounter with nuclear medicine. You hadn't heard of it before?
No. That was the first time. And even more I get to this medicine, I'm fascinated, because I think there are so many opportunities for other patients as well. And I've heard a lot that this is, I will see better than traditional medicine in some ways, even for tumors.
I'm sorry, I didn't mean to interrupt. How easy did you find it to discover what nuclear medicine was? Was the information all easily accessible?
No. Also, it is, I think, for me, I get to the medicine about Professor Peter Baum, because we have a good relationship. And then I have to tell something. After my operation, I should get every 4 weeks injection with somatoline. And this injection each had the price from round about 3,000 euros.
Mm.
And when I was to the next restaging, Professor Baum said, "Oh, what do you have here? The injection was wrong set. And if it is wrong set, it doesn't work for 4 weeks. It is like nothing." And in that moment, I spontaneously said, "Okay, if my doctor in Würzburg doesn't mate, please do it. Do it." And since then, I'm go for even injection to Professor Baum, and so I got nearer to the nuclear medicine.
I see. Understand. Thank you. And of course, we should say that this was all happening, 5 years ago now?
4 years.
4 years ago.
4 years. And since 2 years, they doesn't find anything. Before I have metastasen, and since last year they doesn't find anything, and hopefully it's stale.
So let's go back and just talk about in detail what happened after the colonoscopy and the initial diagnosis.
Yeah.
What was the next diagnostic procedure?
The next diagnostic procedure was in the hospital, where I got a PET CT with gallium-68, I think. Yes. And all what happened around.
And what did that reveal?
Sorry,
what did that show?
That show, it shows the tumor, and it shows some metastases.
And so, yeah, sorry.
Then came the operation. They take away 40 centimeters of my column. Yes, and they found from 15 lymph. I don't know the English word.
Lymph nodes.
Thanks. Lymph nodes. 12 have had metastases.
And so what happened immediately after that?
After that, I got, since then, first every 4 weeks the injection of somatoline, and now every 5 weeks.
And that continues.
Yes, I will have a restaging the 9th of December, and if they don't find anything as well, it could be that I will have for 6 months for the up to the next restaging nur insulin, nur somatoline.
And it's a long haul. It must have been a terrible experience to have to go through for anybody. For you, how would you describe the experience of having the operation and the treatment?
The operation, I think what I said before. I'm a little or more relaxed people than other one. I think the operation was fine, and after the operation, you're not allowed to eat anything for 4 or 5 days. And then I asked, can I eat everything afterwards? And me was told, yes, I can, even what I like, what is good for me. And I like fish very much. And in the hospital was a little kiosk, and they have special fish, very grease, but I love it. And I bought one of this small package, have it on my desk, and the first day I was allowed to eat, I opened it, and the nurses said, I say, she's a little stupid, but it doesn't happen, it works. And that is the way I eat, I drink, I do everything. And I'm very lucky because after the injection, I don't feel anything. Mm. I have no disease. So I think I'm a lucky person up to now.
And your conversations with Professor Baum, with Dr. Baum, what have they told you about the importance of nuclear medicine in diagnosing your tumors successfully so that they could be removed and treated?
He told me, and I know he have, there's a development on nuclear medicine, a development in the diagnostic as well. They developed new PET CDs, very sensitive ones and very quick ones. I think a new first one will be presented in February next year. And he said a lot of people can be better health if they started to make the diagnostic earlier, and the medicine must be known to more people. Mm. It is now it's a small amount of people who know and who accept this medicine, and it must be more popular. Mm. Because it's more individual, and it's not. It's quite different from chemotherapy, where you put something. Nuclear medicine is specified for your tumor, and and chemotherapy it's very spread to the people, and not so good.
And makes you feel terrible. And you referred to the fact that you have never felt awful with your therapy.
No, and I hope it's hold on. But if I know the tumor increase, then I will have the nuclear therapy. Mm. Then it is so. But Professor Baum told me as well, you don't lose hairs or something like that. And and you can have this therapy 1, 2, 3, 8 times. It's easier than chemotherapy.
So you found yourself on the right track very quickly to getting the right diagnosis, the right diagnostic tools used on you. And you said you were lucky that your doctor in Würzburg just knew that this was the way to send you. Why do you think that more people are not able to be put on that track early on?
I think a lot of doctors doesn't know this tumor and the possibilities of this diagnostic therapies. Mm. My internist here, who got me the wrong injection. Say, oh yes, sometimes I have heard about it, but they don't know it. And when I go for the restaging, you meet other patients as well. And some of them told me they need years before they said you have a neuroendocrine tumor, and they get or came to this therapy. They work from doctor to doctor to doctor, and they have a long way to get to this medicine, to the people who know this medicine and to know it right.
And these patients, it must, I mean, aside from the fact that the disease can progress while there is a lack of knowledge about the fact that they have in this case, a neuroendocrine tumor, there's also the anxiety of not knowing and being pushed from one to another, because some people will be strong like you and be able to sort of deal pragmatically with things. But that strength ebbs away when you're faced with indecision and uncertainty, I imagine.
I think this medicine and the possibilities must open for a bigger amount of people. It must come. I have the feeling a lot of them stay at the traditional medicina economy, and they must much more open for new or other medicine. And for me, it's a little. I asked me the question: must something like Corona come, that everybody of health or patients, doctors, and so on, are much more open for new or other ways of medicine?
Do you think that the pandemic has, in some way, opened people's eyes to potential?
Yes, it has opened people's eyes for Corona medicine.
Yes,
but I think for other things it is every time very slowly. Development is very slowly, or opening for new ways, or discuss about companies and governments and patients as to be open for new ways, new ideas. That's my question. Must happen something like Corona, that people for other things like nuclear medicine or
yes,
open for new developments, to increase developments. That is my question. Must there be something like Corona in other ways?
It's a fascinating observation. You're right that a shock to the system changes people's pattern of behavior, changes the way people can conceive of doing something.
Yeah.
But until that happens, everything just rolls along in the same old way, I suppose, in general. I mean, of course, that's not true. Lots of people are trying to change things all the time. But a big shock like the pandemic, changes things. But then a big shock like the pandemic also places immense strain on everybody. There's less time for the health service, particularly, and there's less money around because so much has been spent on the pandemic.
Yes.
What do you know about the costs of your treatment compared to a regular?
Also I know what I said. My injection, each one in Germany, costs around about 3,000 euros.
And what does your injection consist of? Do you know the constituents of your injection? Do you know what it is?
It's called somatoline, and what I said, I didn't ask what they really do, but the principle is what Professor Baumi told. It's you have the tumor things in your body, and this medicine stopped, that they can go to the column or something that undocken. Sorry, it's like a chewing gum that they don't get to to your body.
So it stops the cells where they are. It doesn't allow them to travel. Yes.
Yes.
Well, I don't know. Is that what you tell me? Yeah.
Sorry. The tumor cells go to the body, and this medicine, I say, like a chewing gum, which go to the body, so that the tumor cells don't can go to the body and increase. It's sorry for that.
No, it's nice. It's a very nice analogy.
I try to describe it.
Beautiful. And what about the cost of the diagnostic tools? The
diagnostic tools, around about 4,000 euros each restaging, each PET CT. And I was on the symposium weeks ago from the ECPO, that is, medicine industry, a little doctors, patients, and Professor Baum. It's a foundation, but it's gone. And there I spoke to some people from the industry, and they said, if you have the therapy, the nuclear therapy, each one costs in Germany around about 100,000 euros, and in the USA 200,000. And so that is the medicine what is now, I think, only for rich countries and not for everyone. And that should be.
It should, yeah. But the question is, of course, whether effective treatment, even though expensive, leads to less cost in the end. So,
yeah. Yes, on the meeting, on the meeting of the foundation of the symposium was we called him all long-time survivor. Yes, yet now I don't find the word. I think Bauchspeicheldrüse. So I don't find the word for Bauchspeicheldrüse. Bauchspeichel. Yeah, sorry, but he has a cancer, normally cancer, where you don't have a long survival rate.
Right.
That. And he lived with this therapy, I think, since 14 years. Normally you have months, a year. And that, I think, is great.
Yeah, indeed. You obviously have become very interested in the field of nuclear medicine. Do you belong to various groups that support nuclear medicine and talk about it from patient side?
Not. I just started. The first time you asked me how I work with the cancer, the first time I say, oh, everything is okay. I don't feel, I feel okay. I don't have any, I feel good. And I don't talk about much about my my diagnostic. And since the invitation to the ECPO forum and much more contact to Professor Baum, I say, okay, I have it, and I would like, to say to other patients also as well that there is a possibility, perhaps a possibility. We have. Sorry for that.
Who's that?
Oh. Sorry, I didn't. You have the possibility to do something on different stages, and now I go more to the public and talk about it. And beside as well, I think it's interesting. One of my clients came from the nuclear industry, and they developed a process where you can reduce nuclear isotopes from water nearly to zero. So that the time their idea from waste, you have nuclear waste for a long time. You must find a solution for that. You can reduce it significant. And I told Professor Baum from this startup, and he said, "Is this interesting for nuclear medicine as well? Because after the therapy, you have a lot of waste, even not so much energy like at nuclear or industry, but that is a volume. And if you want to treat more patients, you must find a solution to handle it." So, and yes, on Friday we have a meeting where I bring the both together. It could be over the fields. There can be solutions.
So often in life, one never knows where the solution will come from.
Yeah.
You know, it's that lovely serendipity of people coming together across disciplines to find ways forward. Yes, indeed.
Yeah, so you must be open.
Yeah, indeed. It just illustrates the value of people talking about a subject such as nuclear medicine in general. Absolutely. And so it must be difficult to talk about. I mean, again, you seem to talk about it with an impressive ease, but it must be difficult to be a role model, be a person who stands up and advocates on behalf of other survivors. It's not something that you particularly set out to do in life. How do you find that role? Is it something that you embrace?
I think mostly everything what is on the first look not so good, or bring you in a quite different situation or change your life or something like that. If you work a little on it or go, it opened you new opportunities or to increase by yourself. It's not everything bad. And okay, I think we all know that one time we have to die. This is the best thing. You must see what you in this time, what you will be, that you do the best, that you increase or that you give other people the opportunity to learn from the therapeutic you have, or to open it for others as well, so that it can help them as well. So you see, that is the situation. What can I do for me or for other as well to help them as well?
Yeah. Thank you. What would you like to see from today's symposium?
I would like to see that the industry, the government, find ways together to develop the medicine. Perhaps that money will be offered to increase the development in this medicine and to bring it to the people, to the patients.
And what do you see as the main barrier to that happening?
From my history, I said I worked in the public-private partnership, and it is, from my understanding, it is not so easy to bring the different things from the industry and government a little together. There are two worlds, and you have to work with them. And I think much more important is both sides of the people must be open to work together and to go new ways. it could go, but both sides must be open and must have understanding for the other thinking.
And from your own experience of working in this world of public-private partnership, what advice would you have for the delegates, how they should approach their discussions?
To be pragmatical. It's really, I don't know. I don't know if I should. Well, if you like, I can tell a short story.
Please.
It was the invoices we have. The colleagues from the government side said we were a company, and the governance side said we must have the original invoice. I say, I can't give you the original invoice. You can come and look here for the original invoice, but I must have them for me. Then we find a solution. I make a copy of the original invoice. We send the copies to the government. We got a stamp with signed original. We have seen the original, and I got all the copies back. So we found a way to manage it. And therefore, then you have a problem. Then different sides of you, and then you must go or try to go to find a solution where both sides can live with.
And in this case, it's a place where finding a solution can make a radical difference to cancer patients' lives.
Yeah.
Has Professor Baum told you what would have happened to you if you had not had the diagnostic tests you had?
Yes. The tumor would much increase. But I have, there are different sorts of tumors, and I have one who increase very slowly. But yes, you will have problems with a lot of other parts of your body if it is increased and will be developed late, even of the lunge
yes,
and
yes.
heart. And this the neuroendocrine tumor can come everywhere, even in the head. It is he said like a zebra horse. The horse is
a zebra, yeah.
Zebra. If you hear a horse, or if you heard you see you think a horse, but you never know it's a zebra. It could be everyone, and you must put a lot for this sort of tumor. You must put a lot of medicine parts together to treat the people and to find all the tumors. It is not like another cancer. If you find them in the earlier stage and have an operation, then it is a way. It's a little. My understanding is it's a little kind of. It's a different kind of tumor, and a lot of different medicina have to work together to find out the right diagnostic and for the patients.
Thank you very much. Yes. So it's a nice image to think that one has to put the investment in and pragmatically work together to find the tools in order to identify the zebras amongst the horses.
Yes, right.
So let's talk a bit more about the question of this question of your luck. How do you feel about the fact that you were lucky enough to find this channel to a correct and relatively rapid diagnosis, but many people just don't find the channel and have to wait and perhaps never discover what is wrong with them until too late?
Yes, that is for me very bad feeling that not everybody or I think even with other things you must find the right doctor for your disease, but therefore I told you about my company from the nuclear industry, and that is a point what we discussed is if you have the therapy, and every hospital has a special capacity for this therapy. So, and if the hospitals find a way to reduce the radioactivities of the waste, they can treat more people. So, and that is one point. Beside, I would like to talk to others to everywhere I go. I said how what the nuclear medicine can. I will talk, bring it outside. So I started just. I would like to bring it outside as a possibility of the nuclear medicine, and my understanding is it's much more than only neuroendocrine tumor. So, and that is interesting, and so I will see where I can bring it outside, and on the other way to make the nuclear medicine for what I can do to increase it with new ideas.
And what would you say to people who say, yes, it's a lovely idea, but it's just too expensive to do that?
Is it not much more expensive if you have? I think it is easier to see something earlier and to treat it than to be really ill and then start with treatments. So I think at the end of the day, you make the balance and say what side will be much more expensive. But for me, it's even better to act advance and not behind. To start to be active before and not if you are ill or really ill or bad ill. And every development in the medicine, from my understanding, you need a lot of money to develop new things, new medicine. Doesn't matter if it is in the nuclear medicine or if it is in other medicine ways.
Yeah, things are always expensive at the start. Then you get cost benefit, I guess, as you ramp up.
Yes, and better to treat the people in a much more good situation where you can handle the diagnostic, then it is much more too late.
So in that early phase of your discovery of your disease, what was the first moment that you heard the phrase nuclear medicine used?
When I was in the hospital to the diagnostic, 4 years ago. I've never heard it before.
And do you remember your initial reaction to this phrase, nuclear medicine?
Yes, I'm open to new things. I say yes. I don't. When I heard from my tumor, I thought about chemotherapy. It's the first idea, and then said no, chemotherapy. It's not the way for this sort of cancer. I say, good. Because for me, chemotherapy, it's bad. It had a bad feeling. It's like a hammer, it's you go to a for me a small tumor with a bright spread, and what is not good for other things for your health as well.
And I suppose some people are frightened of this word nuclear, or think somehow nuclear is a bad thing in general. They don't like nuclear. Certainly, obviously, they don't like nuclear weapons. They don't like perhaps nuclear power. So there's a kind of effect of that word on some people. That obviously didn't trouble you.
Yes. But normally medicine for cancer, I say. So the old way or nuclear way, it's all medicine have bad things as well. I think I know what you mean. It is the word nuclear. You don't go to Chernobyl or something like that. It's very small doses.
Yeah, sure. And as you absolutely say, radiotherapy has been the core of cancer treatment for as long as cancer has been treated, in the 20th century at least. But the it's not a sensible reaction to the word, but it is perhaps a reaction, and so it has to be taken into account, perhaps. But anyway, I think we've dealt with that. I love your openness to new things. I love the way you embrace the next stage.
Yes, but I hope for more. I hope for people which are more open. For me, I was my lifetime long. I was open for new things, and much more new they are. They were interesting for me, as much as they were new. But it's on the other. I think you have every time peoples who are open for new development, new medicine, was everything what is new. And then on the other hand, you have people who stay in old times.
And I also love your thought that of all times, at least in recent history, this is a time for new thoughts. This is a time when going back to the old should not be the option. Now, if not now, when will we reinvent ourselves and do things better after this pandemic?
Yes, or you have to combine old and new medicine, but to open and to look. But I know it is not easy. You only have to look for me in your family. I have a 4 years younger sister, and she's only looking to retire and don't want anything what is new or what change, even like with video conferences. It's a good way. No, she only wants to have nothing change in old things. I think for me, I would say a little sad. Yes.
So yes, your family, a microcosm of the world. Absolutely, yes. Yeah. Innovators and those who want things to stay the same. It has been such a pleasure speaking to you, Tordys. Your clarity about all this is fascinating and refreshing, and it's telling your story in this way is very helpful, and I found it extraordinarily interesting, and I'm sure that many people listening, and especially patients now and in the future, will find it useful. So thank you.
Thank you as well. Thank you for your time, Adam.